here. You're most welcome to the NILECAST on Westnile television, where we give you the daily news bulletins of the week every Sunday from 7 p.m. to 8 p.m. My name is Okumuringa Christine. Let's dive straight into the stories that made headlines throughout the week. Patients visiting Arua Regional Referral Hospital for radiology services now have to show smartphones as a requirement to access their results. According to the authorities, it is aimed at reducing on the costs of consumables, ensure a high level of confidentiality, and ensure adaptation to the changing global electronic systems. Frederick Jamadri reports.
Several patients seeking for radiography services at Arua Regional Referral Hospital were turned away following their failure to secure smartphones to access their results. Arua Regional Referral Hospital has moved away from the previous manual system of printing results on papers to a more electronic one, which is transmitted to the patient's smartphones after the hospital received the modern equipment as part of the 31.6 billion Ugandan shillings outpatient department facility from the Japanese government in 2021. This has left many of them who do not have the devices in hunger for the services. A number of the patients who feared to appear on the camera revealed that they have no options but to go back home and look for an alternative of seeking for the same services in private facilities. But Tabu Fred, the Deputy Speaker Arua City, who luckily enough had a smartphone, shares his experience.
It did not give me a good explanation of why they cannot print out for me the hard paper or what was wrong with my back. So up to now, I still have it in my smartphone. Now I ask myself, if somebody has no smartphone, supposing a mother from all the way from Ayubu or down from Ori or from Bara who does not have a smartphone comes for this particular service, what exactly is going to happen to such a mother? So I needed that answer. If the hospital administration can give us that answer of why they cannot print out, I don't know the name of this, if they cannot print out those things for further analysis, what will happen to a patient? Because I saw like 3 people who were turned off because they did not have a smartphone. So
Atayo Paul, a businessman in Arua City, challenged government to be considerate in accommodating technological changes in service delivery.
First of all, a rural person doesn't know even how to use this smartphone. 2, it is difficult to afford. It is expensive. A smartphone ranges, the best one ranges from 300 to 1 million, the best smartphone. 3, I know getting results through the smartphones, it is a good idea. But imagine we have some people from the village who cannot know how to operate, who doesn't have a smartphone. Definitely, you are going to expose your risks.
This transformation is expected to furthermore affect services of X-ray, ultrasound, and CT scan, which are being electronically linked within the hospital. According to the hospital director, Dr. Alex Antema, this is aimed at coping up with the global electronic systems and ensure confidentiality.
We send it to somebody's phone. That person is able to, he knows how to use his phone, and he should be able to access. Or maybe the family member, they could know how to do. You cannot just send it anyhow. You first agree. Can we send it to your phone? Yes. Or you come and read it from me?
Records from Arua Regional Referral Hospital indicate that the hospital has managed to provide services through electronic means to over 200 patients using the modern CT scan. Frederick Jamadri, Westnile TV, NILECAST.
And more in our stories. The Ministry of Health participating partners, together with the Arua City local government, launched a yellow fever preventative mass vaccination campaign for Arua City that started from the 9th to the 13th of June 2023 for all persons aged from 9 months to 60 years of age at Mayor's Garden in Arua City. Let's have more on that story. Today, the Ministry of Health participating partners, together with the Arua City local government, launched a yellow fever preventative mass vaccination campaign for Arua City starting from the 9th to the 13th of June 2023 for all persons aged from 9 months to 60 years of age at Mayor's Garden in Arua City.
I just want to request the population of Arua City not to think twice, to just come for the immunization. It is the only safe way to protect ourselves from yellow fever, and I want to thank His Excellency for ensuring the nation is very safe. because if you have a nation which is sick, economic development will not take place.
Dr. Diwale Alfred, the Commissioner Institution Human Resource Development Ministry of Health, in a press briefing stated that this vaccination exercise is a backdrop of the global decision to eliminate yellow fever as a public outcry.
We are here to launch the yellow fever vaccination for Arua City, and the exercise starts tomorrow. Tomorrow, the vaccination teams are going to start vaccinating the masses in the city. Now, this exercise is against the backdrop of a global decision to eliminate yellow fever as a public health problem. The campaign which we are starting now is what we call phase 1. To vaccinate everybody in Uganda, we are going to move in 3 phases. Phase 1 is districts in the western part of Uganda, starting from Kisoro up to Koboko, and then the districts of Acholi and Lango region. This is the phase 1 districts, and this activity is starting in all this region tomorrow. This campaign is aimed at vaccinating the older persons up to the age 60, while new or younger children who are 9 months of age will be vaccinated through the routine immunization program. In this way, we will have a population which is fully protected against yellow fever as a disease.
Nzukuru Millicent, the Deputy Mayor, Arua City Council, is urging the people of Arua City to use the opportunity to get vaccinated against yellow fever and receive the yellow fever vaccination card for free.
I want to thank the government of the Republic of Uganda under the leadership of His Excellency Yoweri Kaguta Museveni for taking lead to fight any opportunity that could land somebody into sickness or death. Most especially for looking at the people of Arua. Arua City is a regional city. I want to believe as the launch is here in the city, the whole region of Westnile should be covered with this immunization. I also want to tell the people of Arua City, today is the time we are launching for the immunization of yellow fever in Arua City. Let everybody take the chance. Don't miss it, because this is the opportunity to have yourself protected against yellow fever, and to also get a chance to get the card, which in future when you travel you will not spend unnecessarily. This is a chance where you will not pay for the card. All people living in Arua City, let us take this chance and not miss it.
The resident City Commissioner Akelo Alisakena is urging the LC1s of the different villages of Arua City to mobilize the masses to come and receive this yellow fever vaccination.
I want to thank the President of this nation, who is so particular about health. I want to thank all of us who made an effort to vaccinate themselves against COVID. We always struggle to get vaccinated when you're going out, and you pay a lot of money. But today, we are getting it for free. So everybody should run and get this vaccination for free. The LC1s, please, it is your work to mobilize your people in your villages to come and take these vaccines, so that we have nobody left behind. Let's work as a team and we have everybody vaccinated.
This yellow fever preventative mass vaccination campaign for Arua City that will run from the 9th to the 13th of June 2023 is part of the Ministry of Health's national campaign targeted to vaccinate the Ugandan population against yellow fever. Okumuringa Christine for Westnile Television, NILECAST. And more in our stories for the evening. The top leadership of the Democratic Party, one of the oldest parties in Uganda, have embarked on a nationwide tour of improving the party structures from the grassroots to the national level. The team has been in the West Nile region trying, among others, to explain to the public the NRM-DP cooperation agreement signed last year in July between President Museveni and DP President General Nobert Mao. Emmanuel Agele reports more.
Members from the topmost Democratic Party, led by the National Organizing Secretary, Herbert Rutaguera, visited Westnile sub-region to create party structures for the full participation ahead of the 2026 general elections and to give an understanding about the NRM-DP cooperation agreement of July 2022 between President Museveni and Nobert Mao.
We are basically here for things today. The first one is definitely to get in touch with our members. We have to interact with our members, we have to get their thinking and we tell them what is at the headquarters. That's the first question.
When asked on the cooperation agreement between the party and the ruling NRM party, he says many people did not understand on how decision has been arrived at, that he thinks should be shared among members of the public for them to know the terms of the agreement.
This cooperation agreement is not open-ended. It was signed in July last year, and it must last the term of this parliamentary term. So what is this cooperation agreement about? Basically, there are only 4 objectives, and they are totally in line with the thinking of the party. Number 1, dialogue and reconciliation. That's an objective of the cooperation agreement. That's why we signed an agreement with Museveni. We want dialogue, national dialogue. We think things are not right, and we must sit down and talk to everyone. Objective number 2, electoral reforms. Because we believe that the election ground needs to be level. The competition is not level. So we need some reforms to our electoral system to have them reformed. Objective number 3, constitutional reforms. I think we all agree that there are some aspects of our constitution that actually are undemocratic, I would say, or they deter democracy, true democracy. So we need these ones changed. Now these 3, once put in place together, definitely they will give us the fourth objective, which is a peaceful transition.
The president of the Women League, Waligo Aisha, has assured the women that the safest place to be is Democratic Party and engaging in a dialogue is the best way to protect the women of Uganda.
As the president of the Women's League, I'm here specifically to continue working on the women's structures, to begin on the process of candidate identification for the women who are going to stand in 2026 as a means, as a mandate given to me by the Constitution of the Democratic Party. But again, on the big note, I've come here to bring joy to the people of West Nile, especially the women, the men, and all our husbands, that today, Democratic Party becomes the safest place for all women politicians in Uganda. When you could not give your women to any political party, thinking that they are not protected, thinking that they are not conducive, thinking that they are not safe for your women to contest as politicians, that the Democratic Party has recently launched a policy against sexual harassment. That means your women, your sisters, your mothers, and your daughters are safe with DP. We are telling all women that politics is for us, and nothing can be for us without us. For the country like Uganda, that has not seen a peaceful transfer of power, it is time for us to negotiate with the ruling government to ensure that there is peace in this country and there is transfer of leadership. That is what we believe in as the women from the Democratic Party.
Looking at Uganda being bigger than all of us, the Vice President of Eastern Region, Sammy Gilbert, has pleaded that they as leaders should leave a peaceful country for the next generation, as their past has not been so pleasant.
This is our effort, and also a responsibility that we owe Ugandans, that we are ready to work with every person who is thinking of peace, any person who is thinking of delivering Uganda and letting us live the way we think we should be governed. We are not working for NRMs, as many past speakers have said, but we are only helping NRM to get back on track where they have gone wrong, because they should protect and serve Ugandans. When they go astray, we have to put them right. It's a responsibility as citizens.
Today where we stand, we need to do a self-reflection as Ugandans. Leave alone the political class. The foundation should be the ordinary Ugandan. How does the ordinary Ugandan want to see his or her own country? We need to see a country where we are always fighting with our brothers and sisters, or a country where we dialogue, listen to each other, and we are ready to be critical.
Meanwhile, the Vice President for Northern Region, Alitia Elia, has said, despite their few numbers, they have always stood on the truth and justice for all.
The Democratic Party, like members have already said, is a party that strongly believes in the values of truth and justice. And we have been professing these values, irrespective of how few we have been on ground. I therefore want to call upon all of you to stand proud and very tall as we execute this very important activity of elected leaders and structures, and more so with the blessing of our leaders who are here, the National Organizing Secretary, who according to our constitution holds the powers to be the one forming these structures. And for the public who will be listening to us, please, the outcome of this activity will come out of leaders who are approved by the highest order of the DP, which is the National Executive Committee.
Lemeriga Fadil, the spokesperson for Democratic Party Northern Region, takes pleasure in the party for being the only party that has handed over power peacefully. He further says having party structures from the topmost to the lowest level will help them to reduce on the election irregularities come 2026.
Today, we are improving on the party structures. Very few of us have been running the party at executive level. So today we are going to formally, under the stewardship of the National Organizing Secretary, under whose constitutional mandate it is to conduct these elections. So today the highest and most person in the DP is going to oversee these elections here. So they are going to carry the weight of the DP constitution. So people can't go home with the mandates. They know that they have roles to play. That is actually why we are gathered here this evening.
The revisionation and restructuring of the Democratic Party structure in Westnile sub-region is being attended by party members and leaders from Koboko, Maracha, Arua District and Arua City. Emmanuel Agele, Westnile TV NILECAST.
And more in our stories for the evening. The resident city commissioner Gulu City delivered 306 million shillings to women groups in Gulu City as part of the presidential pledge during his wealth creation tour to the Acholi sub-region. Each group will be getting 300,000 shillings. According to the resident city commissioner Gulu City, the president is piloting sending the money directly to the women groups as an alternative means of other government programs. Stephen Okello from Gulu reports more.
Joy as women in Gulu City jubilee receiving presidential pledge. The money is meant to strengthen the existing women group who are already into VSLA.
We will add our capital and it will raise up our loaning threshold, whereby a member who normally borrow money less will automatically this time will borrow full.
Jennifer Balo appreciated the president for fulfilling his pledge. She said Government should come up and support their dreams of becoming a bigger financial institution that can support their fellow women. Piloya Kevin, the chairman of Kachelo Twayaro Group, advised fellow women to remain submissive to their spouses despite being more empowered than their men.
Your husband, because you're financially empowered than him, it's not really right. It's better to be submissive, however much money you have.
Agnes Akelo, the councillor for Bahadege Laivi Division, Gulu City, said this money is meant to benefit some of the women who are not benefiting from other government programs like PDM.
And I requested for money for grant for my people in Bahadege, because as leaders we are seeing that there's programs that come out like the government program, but it will take long to reach our people. For example, like PDM.
Gulu City RCC, Jane Francis Ukili, who delivered this money to this group, urges these women to use the money to support their members in groups.
They should multiply this money. They should use this money for the right cause. But I also trust in these groups, because initially there is some 100,000 they got from the Right Honorable Richard Todwong, and they used it very well.
The RCC says this as she delivered part of the 306 million to 1,767 women in Bahadege Laivi Division, who is part of the 1,000 women groups that was meant to benefit from this presidential pledge. Reporting for Westnile Television, NILECAST.
And more in our stories for the evening. West Nile Region Civil Society Network, together with the Ugandan National NGO Forum, have equipped the leaders of the different social groups from the sub-counties of Maracha and Yumbe district on how they can engage the community members on demanding for accountability from duty bearers. Dennis Soringi reports more.
Leaders of the different social groups from the districts of Maracha and Yumbe in West Nile have been trained on how they can begin using the different social groups with involvement of other community members to begin demanding for good governance and accountability, and holds power holders such as a government official accountable in turns, increasing responsiveness to local needs. The group leaders were drawn from already existing local groups from the sub-counties of Olufe and Tara in Maracha and Yumbe Town Council and K in Yumbe District.
Rest, then they gave productive meeting. Don't forget to thank them.
Feni Tribe, the Chief Executive Officer, West Nile Region Civil Society Network, one of the networks implementing the program in the country, says that the social accountability approaches will enable gathering of feedback from community members on services.
This project is funded by EU, European Union. We are doing it in partnership with the three other organizations. It is being led by Uganda National NGO Forum. In Eastern Uganda, we have PACONET, an organization called Palisa Civil Society Network, but we also have Westnile Regional Civil Society Network. That's going to implement this project in Maracha and the Yumbe districts. So the project is targeting informal groups, because you are aware that people have their savings groups, people have their women groups, people have other groups that are there. So what we're simply trying to say is that other than always congregating and discussing these other things, can you also discuss about service delivery? How can we take duty bearers, the district leaders, the sub-county leaders, to the community so that they interact with the community members, so that the community members will be able to raise some of the issues that they feel these people need to address directly to them in their face, other than speculating.
Asked why only 2 districts from Westnile region have been selected for the program, Feni says district like Maracha has little impact of NGOs. Meanwhile, Yumbe is one of the districts in the region with over 20 sub-counties that leaves a lot to be desired when it comes to service delivery and accountability.
So we were looking at Maracha, where actually the presence of civil society organizations is very minimal. You can bear witness with me. Most of the organizations you see here in other districts, not really Maracha district. We have very few organizations in those districts. So we feel we need to close the gap. We need to be in to contribute. We are not going to totally close the gap because we will not do everything. But the little that we can do, we needed to do it in those districts with those conditions. That's why we chose Maracha and Yumbe.
After every election cycle, Ugandans are left wondering with little being done in as far as providing accountability information is concerned. Chris Kwatisibwe, chief of party at Uganda National NGO Forum, says their move will inform the citizens on how they can always engage their leaders on matters to do with the service delivery, even after the election.
Very weak linkages between the citizens and the duty bearers and their leaders. So oftentimes during the election cycles, we do an election, and after that we find that we don't find leaders interacting with the citizens to get to know their issues and be able to respond. So that is a gap. So what we're doing with this project is to create the linkages and create platforms for regular engagement between the citizens and their leaders. The second gap that we have identified is that citizens do not actually understand the service delivery standards at the different service delivery points. So one of the things we're doing is to popularize and make this information available to the leaders and to the citizens themselves. So you will find that at Health Center 3s we expect to have an in-charge, we expect to have a nurse, we expect to have a midwife, and certain diseases that should be managed at that level. But we know that most of our health centers are not well equipped. So what we're doing with this particular project is to make sure that citizens identify where these gaps are and are able to communicate clearly these gaps to their duty bearers, whether they're civil servants or the political leaders.
One of the participants who attended the training says the skills acquired have informed her on what they will be able to ask in regards to accountability questions that will make their leaders accountable.
Skills we will acquire from this training will help us dig out how and when we need to help, because it will enable us to do research about the things that are the issues that are of concern in the community. Then we will hold our leaders accountable so that they'll be able to give accountability of what the taxpayers' money is doing, particularly in Yumbe.
In achieving all this, Chris says they cannot downplay the role of media in helping to disseminate the information to the general public.
And one of the things we are doing is to acknowledge that the media helps us reach majority Ugandans where we actually cannot reach. So what we are doing is to partner with a few media houses in West Nile sub-region to be able to disseminate this information. The information about service delivery standards, citizens' voices about the key issues they are identifying in their communities, so that we are bridging this gap. At the same level, we shall also be inviting leaders to be able to provide accountability and respond to the issues we shall have identified in the communities.
Dennis Oringi, Westnile TV, NILECAST.
And to end our NILECAST weekly news roundup on Westnile Television, former Archdeacon of Nebi Urban Deaconry, Canon Charles Owen, was laid to rest. Let's have more on that story.
The former Archdeacon Nebi Urban Archdeaconry Venerable Canon Charles Owen was laid to rest today, 8th June 2023, at St. Mark Church of Uganda Ferry. Charles Owen was born on 28th December 1958 at Ashet Village, Ragem, Jopowin, and he succumbed to diabetes at Malago Natural Referral Hospital on 4th June 2023, according to medical reports. He worked at Spear Motors from 1978 to 1979 and later joined Navy District Administration. He joined pastoral work on 18th November 2001 and was appointed as Dean of St. Stephen Cathedral, Gulu on 18th April 2004 and later transferred to Junam Archdeaconry. On 5th January this year, Owen was appointed as Archdeacon Nebi Urban Archdeaconry and consecrated on 5th March 2000. 2003. However, during the burial this afternoon, the Bishop of Navy Anglican Diocese, Right Reverend Pons Ozela Winju, challenged Christians to emulate the life of Canon Charles Owen, who changed many souls into Christianity. The Bishop further encouraged believers to follow standard operating procedures in prevention of COVID-19, since many people have forgotten about it.
For sure, we are burying the son of a king. This reasoning is exactly showing it to us. Do not worry if you are hit by rain.
In a special way, I would like to thank Mulago Hospital. Venerable Canon Charles Owen in Mulago Hospital. I got a very good testimony from that facility. To be emulated by all other facilities locally that we have. Whether true or not, that is a symbol that Corona is still legal. Our people, please be sensitive to Corona. The SOPs, you know. Please practice the SOPs. If somebody does not shake your hand, it shouldn't offend you. If somebody has a mask, please, it shouldn't offend you. This should be a normal.
Meanwhile, Nebi Municipality Member of Parliament Hashim Suleiman highlighted progress of 2-kilometer road works in the municipality, where he said the work is at 67%. Venerable Canon Charles Owen survived by a widow and children. May his soul rest in perfect peace. Alfred Jawoko, Westnile TV, NILECAST.
And with that story, viewer, we've come to the end of the NILECAST weekly news roundup on Westnile Television. Thank you for being with us from the beginning of the NILECAST to the end of the NILECAST, only on Westnile Television. Please stay tuned to the rest of the subsequent programs that may follow. My name is Ukumaringa Christine. Have a good evening.